Hello, Chi Smiles. Hi, everyone. Thank you for joining alive. Hi, Chi girl, how are you? Thank you for joining. Okay, so I will just wait for a few more people to go on board before we start. If you can hear me, just say, give a thumbs up or say hi again. If you can hear me, please just give a thumbs up or a hi. I don't know. You know, Nigerians, we are used to coming. Oh, okay. Thank you. Thank you so much. So we'll wait for others to come on board. You know, we are Nigerians, so we have to constantly. Oh, thank you. Amy, thank you so much for joining. Okay. Okay, so like as usual now, you know, this is our Thursday tonic. So we're all about sharing knowledge and, you know, promoting health. You know, we are here for you guys anytime, any day. So just wait a few more minutes and we start, okay? A few more minutes. So let's say hello. Thank you guys for joining. Please just make sure you stick around till the very end. And if you know anyone that will probably benefit from this conversation, I beg, just send them a link. Tell them to follow at Clearview Hospital on Instagram, and we will start in a few more minutes. So let's just. Hello, Dr. Brown. Thank you for always being our regular audience, if I must say. You know, English is not our so thank you so much for coming on board. Thank you guys, I really appreciate this time. And please, if you know anyone that will benefit from this conversation, please, let's not keep information to ourselves. If information is gold, though, is really golden, you know. So when you have people who run hospitals or who have doctors are not about collecting your money. They're also very particular about your health and well-being. Very important. So please, doctors are all about health. So anytime we take time out to do stuff like this, trust me, it's coming from a place of love. And today's topic promises to be interesting, informative. It's not something you've probably not heard before, but we're all going to try to make sense of everything. We don't have much time. I'll try to use extremely very easy English, not medical English. I'll really come down to our level. You know, I'm not going to use highfalutin English, yeah, but I'll try to make it very understandable, something that anybody can relate to it. So today we'll be talking, of course, you know, this still remains your fertility focus on Instagram Live. And today is a very interesting topic. We're going to be talking about something that is actually very bothersome. And guess what? It's something that happens in every 10 patients that comes in with infertility. Every 10 patients or every 10 couples that come in with infertility. Out of that 10, 4 of them will be told that we don't know why you're not getting pregnant. And so that's one of the reasons why we're having this live. Let's try and demystify what's going on. You know, I remember last time I had a conversation with you guys and we talked about, you know, conception is much more than physical. You know, sometimes you don't understand. There are some spiritual, not the village kind of spiritual connotations. I'm talking about energies that come with it. Do you understand? So one thing you must understand is health is so important. Health, for you to have optimum health, your body, your mind, and your spirit, they need to be together. They need to agree to be on the same plane. So your body cannot be doing one thing and your mind, definitely there's going to be an imbalance. So we're talking about unexplained infertility. And how do we, create a balance? How do we, what's all this unexplained infertility? There's nothing as distressing as when a couple is trying to make a baby and you go to the hospital, they tell you, madam, you cannot make a baby. What's going on? And they're telling you you have infertility. More so, they will now add pain again and tell you they don't know why you're not getting pregnant. And don't forget, the couples might have done myriads of tests. I'm sure you guys know there are cases like that where people have done all sorts of tests, all manner of tests that you can imagine, where they take all sorts of body fluids, everything, and still maybe for example, the structure of your uterus, your womb is intact. No blockage, no nothing. You probably never had a history of termination of pregnancy. If you heard people who have had termination of pregnancy, maybe in that case, they probably had an infection and then their tubes got blocked. No pregnancy. At least you know where the problem might be coming from. Yeah. But in this case, this is someone who probably preserved herself, or they preserved themselves. They did everything. They probably paid tithes, and the womb is okay, or the hormones appear to be normal, nothing out of place, and no pregnancy. Now, I'm here to let you know that whether unexplained or not explained, there's always a cure. That's my belief. That's what my faith tells me. There's always a cure. And thankfully, thanks to God, He keeps blessing doctors with a lot of knowledge and breakthrough science. Even if we say science can never replace God's work. Never. But He blesses us with knowledge. This brain. I'm not joking. The way people view fertility in the past is not the way people are viewing fertility. There's always a solution to everything. Always. So anyway, I'm here to let you know that even if you have been diagnosed with unexplained infertility, and I'm talking about infertility, maybe failed reproduction or reproductive functioning, whereby you've done all sorts of tests and they don't know what is wrong with you, understand that there's always, forget it, there's no smoke without fire. That's my belief. No matter what they tell you, there's no smoke without fire. It may be something that has been missed. It may be something that we overlook. It may be in our daily life. It may be the kind of things we attract around ourselves. It's very important. And I'm telling you, I always encourage a lot of couples, start living intentional. Last week, you talked about helping couples overcome this, this stage of waiting room. And I remember I told you guys that the couples, the husband and wife, they need to sit down and agree that nothing is going to come between them while they are going through this stage. Nothing. They need to really be there for each other. They need to love and support each other. It's very important. And this is all part of helping in the process of reducing stress. So no matter, thank you very much, Miriam. Thank you so much. So like I said before, this unexplained infertility, it doesn't mean that you are totally useless or you lose any opportunity of ever getting pregnant. No, don't let anybody tell you that. Unexplained does not, it may be delayed, but it's not denied. Now, I always tell people, when you have a case of unexplained infertility, let us go back to the drawing board. You need to go back to the drawing board. It has to be a case of maybe there's excess of something which we need to reduce, or there is a case of deficiency. Maybe something is too small going on in our body that needs to be replenished. Yes. And why am I saying this? We know that there are different causes of infertility. We all know that. But one of the major causes is hormonal imbalance. And reports and research has shown that stress, let me tell you something, I need to understand this part. The kind of things we eat, our diets, our lifestyle, how we cope with stress around us, and everybody can agree lately, even living in Nigeria talk less of Lagos, is stressful. Even ordinary sleep, you want to sleep for how many hours, you don't still wake up refreshed. Talk less of someone who is trying to make a baby. You that you already have a baby, or everything seems balanced. Imagine you feeling stressed. Talk less of someone who is going through that waiting room stage. So, like I said, we all need to go back to the drawing board. What is that one thing that is causing an imbalance in our body? No, I need the people to just sit down, think about it. Are you saying that, no, there's something not right here? Do you understand? There has to be something that we are missing. So I always tell people, as a woman, let me start with a woman. You need to start with what you have first. And what do you have? Your menstrual cycle. A lot of you you don't even understand you don't even understand your body. Talk less of your menstrual cycle. You need to go back to the drawing board. Calm down. Get a book and study your body, especially your menstrual cycle. A lot of you think that you're ovulating, meanwhile you're not ovulating. That you have pain in your lower abdomen, that's your lower stomach, does not mean ovulation. A lot of people start thinking, because of what you hear or maybe what you read in University of Google, they'll tell you, when you experience pain on your stomach is ovulation. No. Start with the basic natural things. When you know you're a woman and you're menstruating, start from that day. Start to calculate the day. Indicate it. And after your menses, of course, you indicate it. You need to start noticing some basic things about your menstrual cycle. Start charting your basal body temperature. Start with the natural things first. You know that one thing, the reason why we are doing this is that temperature at a particular time in your cycle should move from low to a little high. It shouldn't be too high. If your temperature is too high, what does that mean? It means your body there's too much heat going on. And when there's too much heat going on, it's not a good thing. That is no room for a baby to be made. You know that now. It's literally like your eggs will be fried. Okay? So always chart your basal body temperature. For some people, the temperature usually, they don't even have temperature. It will be flat, normal. That's not a good thing either. At a point when you're about to ovulate, your temperature should be high a little bit. It should have risen from the normal 36. Okay? You know that sometimes you feel like your body is hot. Use a thermometer. You must have a digital thermometer. A digital thermometer is more objective, and ensure that you put it off. Or maybe some of you that know how to remove the battery, remove it. But a digital thermometer would help to, give you a more objective temperature, body temperature. Okay, so it's always important to chart it at least for 3 months. It gives you an idea of what's going on in your body. Not only that, your vaginal mucus, there's a particular mucus or discharge that comes out when your body is when you're about to produce eggs. Yeah, and that mucus usually is like egg white. For some people, you don't experience it, but you would not know because you've never really sat down to study your body. One thing you need to know is that God has created that mucus to occur at a particular time in your cycle to make the sperm move easily to meet your egg that needs to be fertilized. Okay, so if the mucus is not there, is thick, what it means, it will be struggling. There'll be almost like, maybe hopefully I will put up illustrations. This is a live session, so we can't really but just imagine Ogi. Compare Ogi to egg whites. What do you think will swim? Of course, the sperm will swim easily with egg white. You know how slippery like egg yolk is. Talk less of egg white is compared to Ogi. Ogi is not really, if you try to pour Ogi, thick Ogi, it will just be hanging on the spoon. So you need to start observing these things. Take time to observe your body. Take time to observe your temperature, the vaginal mucus. Note it. There comes in a chart. If you don't know it, send a personal DM and I would give you a link as to how to start chatting or something you can use to chat. Even our phones, smartphones are doing these things these days. Then thirdly, your cervix. It's so amazing. Now, I want to plead with you. Any of you who do not have an idea what I'm talking about, take time to visit at our hospital. I mean, these things are literally free of charge. We'll show you how to do it. Like, your cervix has to be soft. It gives you an idea that, okay, I'm entering my ovulation. Put your finger into your vagina and feel your cervix. Usually when you're not even ovulating or after ovulation, the cervix comes closer and you feel it closer in the vagina. But if you're about to enter your ovulation, it's way high up and the lips are actually very soft. A lot of things like that. So understand your body. Now, let me even shock you. Do you realize that your body needs to have that your vaginal environment, there has to be the pH of even the discharge. There has to be a level of pH. Like, it shouldn't be acidic. It shouldn't be too basic. Do you understand? Whereby it is a favorable environment for the sperm to survive. Do you know that sometimes when things are supposed to be normal, you won't even know when the fertilization should have occurred. Something you probably eat can change that pH almost immediately, and then the eggs, the sperm might not even survive. Just that mistake. And then they'll be telling you unexplained infertility. So we need to be and that is why we are here, to help you create that balance. Okay? So your pH, the pH of that discharge or that mucus is very important. And that is why we always advocate that you eat certain kinds of, you see, we need to be very careful, especially all of you that are waiting to have babies. It may be that you are the cause of your problem. Okay? So the kind of food you eat can tip that pH to be too hostile for the sperm to survive. Okay? And some of you use lubricants that have chemicals. Sometimes you even eat foods that have chemicals. All this processed junk food. You know, in those days, these things were not so rampant. Yeah, forget the fact that maybe the documentation was poor. But now, our problem is even more because of the pollution. Even the turkey that we are eating, all this food they are eating, that they use all sorts of manner of chemicals to store it, to produce quantity. You people know what I'm talking about now. That's why some people still eat fresh chicken. Yeah, all this old layer they will buy, they'll kill, because they know that those kind of chicken, they eat natural food. Okay, so moving on, research has shown that even as much as we are talking hormonal imbalance, stress is a major problem. I know you've heard this thing, but I need to stress it. Stress tips the body, the energy to be so negative. Let me tell you what stress does. Ordinarily, for those of you who are not even looking for pregnancy, or people who are not knowing, ordinary stress, maybe for example, you are looking for work and you don't even have work. Do you know the stress? You don't sleep well because you are worried about the next food. Talk less of maybe you're having problems in your office or your home front. The stress, the mental stress. For some people, they can't even sleep. For some people, they can't even eat. So how much more a woman who doesn't understand why she's not getting pregnant? And more so, she's in a situation where maybe her guy is giving her problems at work, or her work is even stressful that demands that she doesn't even sleep well. The body releases chemicals. I want you to understand this, and you need to understand this. In as much as there are chemicals that create an environment for conception to happen, there are different chemicals that God has created to help to produce eggs, to help to maintain the womb, to help to make it easy for the sperm to swim up and feed that egg. In the same way, there are situations where we put ourselves that will create chemicals that counteract all of this. And let me even, because it's so overwhelming, the information is so much that I need you to really stay with me on this. To know that anything you're doing it, you see, you're working against yourself. You are the one that has that power to decide that I will not put my body, this is about me now, to take care of me. I want my future child to be happy when they're coming. So don't let any negative, you have to start now to create that balance in your body. If you know that you are in a work that stresses you, that doesn't allow you to get home on time, doesn't allow you to sleep well, you don't even sleep up to the 8 hours, forget about 8 hours, 6 hours down. Doesn't allow you to eat, makes you go and be buying junk food. Trust me, my darling, you're not ready for this conversation. It's important that you understand that the chemical you are releasing in your body is working against your womb. Is working against your womb. While the chemical that makes your heart beat fast, makes you have headache. Do you know that you are not allowing blood flow into your womb area so that the function, the reproductive function, it will do what God has created it to do? That's the honest truth. When all the blood has rushed to your brain, and all this feeling of maybe my stomach, everything, your body is just doing you one kind. You know what I'm talking about. You are depriving your womb of oxygen and all the necessary blood for it to survive. So you need to be very careful. Stress is very, very, in fact, some people have very bad coping mechanisms. If you know you are in a situation where you have palpitation, you're not sleeping well, you have headache, you have crawling sensation, because a lot of times they have crawling, you feel like something is crawling on your head. That's stress. It's stress. If you're in a situation where every day you are going where you know that people, the people they are not, they give you negative vibes, they make your heart, your body, there's some people, when you go to, there's some places you go to that you know that the spirit in this place is not good. Why are you there? Why? You have put yourself on, it's the truth, you are putting yourself in constant fight or flight mode. And when you have constant fight or fright mode, when I say fight or fright and fright or flight, you know how it is, as if your body is under tension. What do you think will happen to your blood pressure? Over time, your blood pressure will continue to rise. And you think that a baby can come in a situation like where blood pressure is high. All the things that make the blood pressure rise is depriving your womb of blood, just in case you do not know. Because now you have decided that, okay, blood flow will not get to anytime. Just remember this, the things that make your body hyper is making your womb hypo, in the sense that it has reduced anything that makes your body under tension, not relaxed. Just understand that it is depriving, your womb is being deprived of blood. So it cannot do what it's supposed to. All the chemicals that are supposed to help the eggs to function well is not going to work. All the chemicals or hormones that are supposed to make the womb favorable for you to have normal blood. There's some people, when they are stressed out, they don't see their blood, their menstruation. So what are we talking about? Irregular menstruation. That is another clear sign of stress. There's some people, they don't eat well, they lose so much weight. Remember I told you something, that what you need to correct any imbalance, understand something. If there is too much of something in your body, that means you need to reduce something. If there is too little of something, that means you need to replenish it. That is where the imbalance is coming from. Your body is doing left. Anyway, without stressing, I just want you to understand that all this unexplained infertility, it's not as if there's no explanation. It just means that your body is all over the place. Because if they've checked you, your womb is correct in position. If they've checked you, your hormones are okay, relatively within normal. If they've checked you, a lot of things, just know that even if your hormones are for the women, female hormone that's supposed to help you create a baby, or fertilize an egg, even if it's normal, the fact that your brain is releasing a lot of, is under tension, pressure, there's what they call adrenal glands. When you have high level of stress, when your body is experiencing a high level of stress, there's something called adrenal glands. You can go to your university or Google it. It produces a chemical called cortisol. When your level of cortisol is high, forget it, nothing will function. You won't even be able to sleep. Go and check it now. So you people are fond of going to university or Google. So go and check it. They will tell you the same thing. So you should always ensure that you constantly put your body in a situation where you say, tell yourself today that I'm preparing my body to receive my future child. And guess what? There's a solution. It's just that so a lot of people we see, when they tell them, oh, nothing is wrong with you, they are ready to wait till their body is balanced. But for some people who do not want to wait, we'll talk about those people where the options come in. They say, well, since my eggs, I can get my egg, I can get and my husband's sperm is fine, maybe somebody can help us carry that baby. We have options like that. Yeah, true. But guess what? Do you know that there's a situation where they will tell you, you go to some hospitals, they'll tell you, oh, madam, you don't know why you're not getting pregnant. It will not stop the doctor from still checking why you are not getting pregnant. Do you know that in the course of even checking, It's kind of, I don't know, it happens a lot. We see these things a lot. In the course of just checking, maybe there's nothing wrong with you or your hormones are intact. Do you know that just mere checking, for example, there's one instrument that they use to check, they call it a hysteroscope. Yeah, they will check your fallopian tube to see if maybe it's blocked. While they are checking and passing the thing that looks like a camera through the tube, do you know that it's almost as if your body just needed somebody to touch it? And then I know a lot of people that got pregnant like that without any assisted form of reproduction. We didn't assist them. Just mere checking. Let me just check if your womb is open. Let me just check if your tubes are not blocked. Do you know the person gets pregnant? So sometimes your body just needs a little bit of a push. Let me just help. You know, when a child is trying to learn how to ride bicycle and they've been trying, and all of a sudden the parent now says, okay, let me help you. So the child will not know when the mother just push small and then they'll be riding it on their own. That's what happens in that case. So there's so many cases like that. Now, not only that, you also need to understand that I wanted to mention something very important. I have to remember it in the course of this checking. Anyway, let us go straight to what we can do to create a balance in our body. I think that's the reason why we're here, and you need to take it very seriously because now it's getting really, really rampant. Please. Now, the first thing you need to do, if you know you have been smoking and you drink alcohol, please, alcohol, caffeine, smoking, avoid it. Tell your spouse. This conversation is not only for the women, for the men. Please avoid even Lipton tea. I don't even like the idea of green tea because green tea is not too far from coffee. See, just take normal beverages if possible. Green tea is not as bad as coffee, but please just avoid for now. Let us create a balance in our body. We want to create a situation where everything is balanced in our body. We don't want too much of this in our body where we'll now be reducing. No, just avoid. Avoidance is the best method. Avoid alcohol. Tell your spouse, your husband or your boyfriend or your partner, avoid alcohol. If you want to make babies, avoid anything that contains nicotine, caffeine, just avoid it. Secondly, you need to start taking extra folic acid and calcium. All these things are very important for the body because sometimes it might just be one deficiency, one mineral or vitamin in your body that is just not allowing things to happen. Okay? You need to keep your weight within normal. Exercise is good. We're not saying you should be skinny or be lekpa. You know, I told you too much of everything is not good. Moderation is very key. But where in a situation where you don't know how to be moderate, just avoid. Okay? Exercise moderately. So I tell people that the easiest form of exercise you can do for yourself to keep your blood flowing is brisk exercise. Wake up in the morning, do it in the evening, go to the gym, do a treadmill thing, but at least for 1 hour, it will make more sense, please. Okay? 1 hour of treadmill, very important, keeps your body moving. Then another thing you need to do is that you need to start eating a lot of natural foods. I don't even know. There's no other way I can even stress this thing. Trust me, natural food has been saving lives since 1900. A lot of you don't know, but it's the truth. Because the chemicals are the things that tip your body anyhow. I'm going to make you understand that even women, you women that are trying to get pregnant, do you know that too much of vitamin C2 is not good? Don't do more than what is a recommended dose. Some of you feel like, oh, if I take a lot of vitamin C, my body will be normal. No, you're causing problems for yourself because even too much. Let me tell you something. To be honest with you, I wouldn't advise you avoid any citrus food right now because too much. There's some oranges that are not sweet, and too much of that can tip that pH to be acidic. And I told you what acidic environments do to the semen. They don't make it favorable for the semen to even pass. They kill it immediately. So we want to keep alkalinize the environment for the semen. So try to avoid any non-citrus foods for now. We're not saying that later when we've achieved our aim you can continue, but for now avoid these things. So we talk about exercise. You eat a lot of natural, not processed foods. Avoid processed foods, okay? And when I talk about processed food, I'm talking about junk food, all those food you eat in a packet, anything natural, anything that is not inside a pack. Avoid any processed food because if you check, there might be some chemicals that are just not good for your body. Okay, then try to eat, like I said, alkaline foods like so what it does is that I've told you now, the alkaline food, what it does, it provides a good pH. Go and check the meaning of pH. I'm not telling you good pH. Go and check pH. It provides a good environment that is not acidic for conception and implantation. So when there's the environment is not acidic, okay, there will be room for the sperm to move nicely without being killed, premature death, and then be able to fertilize, and then there'll be implantation. Okay, so things like cereals, a lot of cereal, eat cereal is good. Cereal is good, you know, like Weetabix, all these wheat-based food. Take vegetables, okay, and of course avoid non-citrus foods for now. Then acidic foods like meat, dairy products, and all of that, avoid them now, because they make the environment, like I said, very hostile for the sperm. Okay, then you eat hen. What you need to also do is increase your intake of fatty acids. I know a lot of you mind essential fatty acids. There are many there are many foods that contain essential fatty acids, and things like fish, all manner of fatty fish. Okay, all manner of fatty fish. Take your fish oil, and fish oil now, for example, you can get it in cod liver oil. I'm sure you guys have heard of cod liver oil. Start bombarding yourself with that's very important. Then take flaxseed. Okay, maybe you know what, next time in the next time we're having a conversation, I think I'll just bring what flaxseed looks like. Just that, you know, I'm not in a paid advertisement, so I don't want to, you know, be advertising, you know, I don't want to be showing what they don't ask me to be showing. So but flaxseed, I want to show you guys what flaxseed looks like. You won't get the raw flaxseed, you get powder flaxseed. So anytime you're taking things like oatmeal in the morning, sprinkle like 1 or 2 scoops or 1 or 2 spoons, teaspoons or tablespoon of flaxseed, and mix it in your food, mix it in your beans. Flaxseed is very, very, very good, proven for fertility. Okay, so flaxseed, things like broccoli, they have lots of veggies. If you go to proper health stores, trust me, they have all manner of vegetables. So start learning how to take a lot of vegetables. Cauliflower, I'm sure you guys know it. Even malams, they sell cauliflower. Ask them. Take beetroots. You know, beetroot is red, it's very good. It has a lot of vitamins that are good in helping to boost fertility for man and for woman. Okay, these things I'm telling you, it is chukuli. I'm telling you the honest truth, and I'm going to go down to the reality of the facts. There's something, in fact, the last conversation I'm going to have, a lot of you need, even if you are claiming you're eating all of this, there's a particular behavior that does not allow pregnancy to happen. It keeps your body in a negative energy level, and I'm going to explain to you. So you take a lot of omega-3 fatty acids, take a lot of vitamins, and the kind of vitamins you should take are vitamins like vitamin A, vitamin C, vitamin E, B complex, of course, and zinc and selenium. Those are the major fertility vitamins. I'm going to take it again. Vitamin A, vitamin C, vitamin E, and B complex, zinc and selenium. Now, I have, we have this pack up. I should have brought it to show you guys. So, of course, if you need it, you have to come down to the hospital to get it. We have very solid vitamin C powder that contains zinc and selenium, but that's by the way, I'll show it to you guys later. So you can also take B. For those of you who are familiar with Forever Living products, you know, they have this what they call B Proline and Royal Jelly. Very good. That's very good for fertility. Okay, now then some other things like folic acid, coenzyme Q, and all of that. So these are things that help to, you know, create a balance, a positive balance. And another thing I forgot to mention is that there's some ladies that do not know that they're bringing out breast milk even though they've never had a child. Please, I don't want to forget this. Ensure that you come into the hospital for a check, or any of your, maybe go to your GP. You'll find out that there might be a high level of prolactin. Now, prolactin is a hormone that produces breast milk. Okay, if you've never gotten pregnant or never had a child, you have no business bringing out breast milk. When you start bringing out breast milk, or you start seeing breast milk, or you're bringing out milk from your breast, it shows that your body is telling your body that it's preventing your body from getting pregnant. because that is one hormone that counteracts pregnancy. It's almost, some people use it as a form of contraceptive. So you should check to make sure that you're not bringing out milk from your breast, okay? But anyway, that can be, like I said, it can be treated. Now, avoid unnecessary use of medication. If you have ears, start hearing. A lot of you, every time you feel body pain or headache, you rush and go and take ibuprofen, diclofenac. Newsflash. Do you know you are inhibiting pregnancy for yourself? Those things prevent or inhibit ovulation. Those things, like all those your ibuprofen, avoid. If you can avoid any medication, see, before you pop, if you are looking for a child and you know you are in that category, please, before you put anything in your mouth, visit a doctor, especially your gynae. It's very, very important, okay? Because all these drugs you are taking and you're thinking, okay, because I can buy it over the counter, you are free to take it. It is a no. You are preventing yourself from ovulating and even getting pregnant. So if you think that, okay, paracetamol is harmless, so therefore you are doing yourself, so stop it. Now, avoid things like taking decongestants. A lot of you take a lot of cough syrup. They tell you that you want to, your nose is blocked and all of that. Do you know that those things also inhibit ovulation and pregnancy? So you need to be very careful. And then they'll give, some doctors are fond of giving you Piriton. Some of you use Piriton to sleep. Right there, you are doing yourself more harm than good. Do you know what? Do you know why that Piriton is not a good thing? All those things that maybe if you have catarrh or you're always sneezing, you need to be very careful. Be coming down on taking those drugs. You know why? Because if you are that kind of person, that the reason why you're not getting pregnant is because you're not having your mucus, the discharge that is supposed to allow sperms to swim, is dry, scanty. Do you know that by taking those antihistamines, you have completely dried it up? So it cannot even give, because that's what antihistamines do. They actually dry secretions up. They dry it, they keep you really dry. So by taking it, you are not allowing your the sperm, you won't even allow the sperm to swim up easily, because it will be so, the environment will be too unfavorable for it. So don't take those things. If you can avoid taking medication, please avoid. If you feel you need drugs, see a doctor. Don't just go to the chemist or the pharmacy that you know, because you know them, they'll tell you something. No, pharmacists are not doctors. Another thing I want to also stress on is avoid junk food. Please, if you're in the habit of junk food, fast food, avoid it. If you can avoid it, this is not a matter of giving yourself a treat. The fact that the thing is sugary and the thing is caustic, all this mineral you're drinking, avoid it, please. I don't know any. Okay, let me shock you. Let me give you a reason why. Let me give you a method to remember. Anything that is doing shh when you open and doing shh. Just that, imagine that shit is frying up your organs, just in case you do not know, from your system to your, so it's not allowing anything to function. And I heard that people even use Coke to remove stains from their clothes. So imagine something as caustic as that, and you are bombarding it into your system. Please stop it. I don't know why you're giving yourself too much headache. And then too little sleep, it is not good. Avoid going to bed late. Stop carrying your work from your office to your home, and you say you're looking for baby. It cannot work. Those two don't. You need to keep your body balanced. Your body has to be balanced, okay? Your brain has to function well. Your mood has to be good, okay? Avoid excessive exercise. Who are you in competition with? We're not saying you should be lekpa. Lekpa is not what, it's not a criteria for pregnancy, okay? There's a way you even lose so much weight, pregnancy will not come. So please keep everything in moderation, okay? Start having a timer, okay, to in which you used to go to bed. Now, I want to stress something. A lot of you are very negative. That's what I want to use to round up this thing, and that is what is causing your imbalance, your hormonal imbalance. Your body is not in balance. Your spirit, your body, your mind are not in balance. A lot of you are harboring hates as I'm talking to you now. There are some people that you are not talking to. There's some people that you have sworn that it will not be well with them. You carry them in the mind. There's some people that you don't have a forgiving spirit. Please, there is no way you can bring a child into that environment of hate. It is not doing you any good. The person that you are even hating, the person that you are envying, the person that you are talking about in such a negative way, you don't need such negative energy in your body. I've told you before, it's a matter of positive and negative energy. You have to decide what is more important. You have to start learning to release a lot of all this negative energy. If you know there's somebody that keeps annoying you and you are having malice, go and make amends with that person. Free the person from your mind. Free your in-laws, free your uncles, free your sister, free everybody, your village people, free them from your mind. Right now is between you and God, so that you are creating room for your baby to come. You know, for me, I feel like everything is not all about you cannot be telling me unexplained infertility. There's explanation for everything. Okay, so with all these things I've told you, if you put it in practice, trust me, you are good to go. Come on, I just realized I've been the only one talking. Can't you? People should say something now. You have questions. Don't be listening to me talk. No, this is not supposed to be a one-way thing. We're supposed to be interacting. If you know you've had experiences or someone has told you something, talk, share your experiences. Come on, guys. I'm not a lecturer. I'm just here to inform you. And then we're supposed to be demystifying a lot of things. So please go ahead and ask me questions. Okay? Thank you guys for listening. But before we go, you need to really put all of this into practice. Okay? You need to put all of this into practice. It's very important. And then we have solutions to do for all these things. Guess what? There's surrogacy. There's room for surrogacy. So if you know you are not ready to start waiting for your body to be in balance, you can come in. We'll run a fertility check for you. There's room for you to collect your eggs, help you fertilize those eggs outside, and get someone who can help you carry your baby to term. There are many ways to solve. But you know, we live in a very cultural society where we must show that we are pregnant to prove to the other person that this belle. Oh yes, please, Tall Star Fashion, you have a question, please go ahead. I'm very open to questions, very open to questions. So please go ahead and ask your questions, and please forgive the network if you know you're experiencing any form of slowness or hanging. My dear, now so Nigeria be the way the network is the way Nigeria is. So I have absolutely no, please ask your question. Ask your question. I don't know why it hasn't come yet, but I believe that it's gonna come. And then guess what? While you guys are at it, please go and follow Clearview Hospital sister page. It's called Mofili saying, I'm just wondering why girls will carry belly for me yet go through all these things, but I'm not meant to let them get pregnant. So we have another question. Okay, Mofili, I don't have anything to say to you. Then Tall Star Fashion, ovulation test kit indicated I was ovulating, but I was dry down the yes. That's just it. Some of these ovulation kits are not very reliable, and I will not advise that you rely 100% on them. Okay, so what I would suggest, maybe you want to send us a DM directly. I would answer you more, and I think I promised I'll send a link as to how you can also chat. It's good for you to take time to understand your body, and I've given like 3 basic things that you can use to understand your body. We have to start chatting now. Start by recognizing the norm from the abnormal. Start by recognizing your body, your basal body temperature. It's very important. Like I told you before, if your the temperature is too high, it's not a good thing. Okay, so use a digital thermometer. I think I prefer more of that, and then watch out for the mucus that looks like egg whites. And if you're not getting that, we need to find out why you're not getting that. Sometimes when you have too much of a particular hormone, it won't allow that to happen. Okay, there are different hormones that play major roles at different times of the menstrual cycle. Okay, so when you have, what's the handle for Clearview sister? Oh, thank you. Ask the Family Physician. But I'm more active on Facebook. I'm trying so hard to start something on Ask the Family Physician. Okay, we are very community people. Okay, so we are very down to it. We don't always believe in drug, except where it's very necessary. So please, go follow Ask the Family Physician. that'll be I'll be very honored. So you guys are big, Facebook and on Instagram. Thank you. So Tall Star Fashion, you can always send me a DM. You can talk more about that. I don't think we have too much time left. How much time do we have? No, I'm not stopping. I'm enjoying my people. What do you mean? No. Are you guys not enjoying me? I'm not going. How many more minutes do we have? We die here. Anyway, so like I said before, so try and do all of these things, and I'm sure by his grace we'll get answers to it. So don't forget to send us a DM. You can always stop by at the hospital. It's situated in Lekki phase 1. We are very family friendly, like we're family oriented. Trust me, we will receive you with open arms. My handle, okay, ask the family physician, and please follow Clearview Hospital too. Okay, thank you so much. And guess what, we're going to have a now we are going to be talking real talk now. This is not a matter of talking too much highfalutin something. We're going to be looking at why are people not getting pregnant, and even when there's certain conditions that people will tell you, oh, you can never get pregnant, like endometriosis. We're going to talk about all of those things and what you can do naturally. But please, as you are living today, understand that we should start living intentionally. Remember, you're preparing a way for your future child and everything. I should not go. I'm going. So we are preparing a way for our future child. So please ensure that you start living naturally. Avoid junk food, like I said, and start eating natural foods. A lot of natural food. I'm hoping that with time, if you, I'll send a link to certain foods that are good for the sperm health. I'll send for semen health or sperm health. I'll send you certain foods that are good for ovulation. Certain foods that you should take particularly for the reproductive system. And then, most importantly, please, it's very important that if you've never had a physical done or any examination, just come into your hospital or our hospital and we'll run a physical on you, because as the Chinese would say, there has to be a balance, and they always believe that a lot of infertility issues come from a lot of toxicity from the liver, from the spleen. So you have some people tell you that let me go and do some liver cleansing so that everywhere will be open. A lot of things like that. So I know we can't say so much now, but I hope that you've been able to gather something. And if you haven't and you are coming in late, please send in your questions. I will definitely reply you. And thank you so much for joining. Make sure you call your family members next week, same time, 6 p.m. Thursday. Yes, there will be bumper sessions coming up now, and very real down to earth talk, and get all your questions ready. So once we put out the topic for the week, just get your questions ready. And thank you so much. I love you guys. Thank you so much, and do have a wonderful rest of the week. Bye.